Hey docs, hello students, this is Dr. Claudia Anrig. I'm the co-editor of the fastest selling textbook in the world called Pediatric Chiropractic, and we're in our 3rd edition. We're just so excited about it. And what's exciting about this textbook is the fact that I'm bringing some of the authors to Life University for a new 100-hour certification program called Adjustors Art, and we are so excited about this. 7 live classes, that means 84 hours of content, as well as 16 hours online. Tell me a little bit about the online classes. Well, we're gonna get scoliosis, just understanding it, the biomechanics behind it. It's gonna be about breastfeeding, working with special needs, x-ray, case management, and a whole host of things that it's gonna be take home on Monday morning. But even more important than that, it's those 7 live instructors. Wow. Imagine these masters coming to our one teaching room, our one adjusting room, and there's only 40 of you there. Just 40. That's right, private, hands-on. And one of the things that I know that's happening in our profession, it doesn't matter when we graduate from chiropractic college, maybe even where we graduate from chiropractic college, shouldn't we all be doing better with our techniques? And one of the things that most doctors, when they share with me, one of their concerns about their confidence in taking care of pregnant women, newborn babies, and children with even special needs, is the fact they don't know how to do a good exam. They don't even know how to adapt their hands or their specialty on that particular population group. And I thought, you know what? I know a lot of masters out there. And what if I just contacted a university, such as Life, and we would bring out a 100-hour program. And those 7 live classes, you're gonna be with the best of the best. For example, you're gonna learn from Dr. Patrick Montgomery. He's a professor at Logan Chiropractic College, and he's been teaching the Logan technique for decades now. And he's gonna come to the 40, 45 of us, and he's gonna teach you everything you know for perinatal and for infants to children. So 12 hours on exam and contact, and you're gonna make those babies so much happier. I mean, when you put that slight contact on the bottom of the sacrum, and those babies sleep better at night, you're gonna improve colic and other digestive stuff, and just they're putting that baby back into a better ease. And again, part of that is just not the how to do the Logan technique, it's the examination. So when should you apply this Logan technique? And everybody could do a lot better with the area of and the technique of when it comes to cranial work. How do you work with the tongue-tied babies? Maybe post-dental revision and so forth. Or how do you deal with a baby who has plakocephalgia? I mean, how are you going to care for those babies? And how do you do that with clinically hands-on? And so we're going to bring 2 weekends out for that. Dr. Mary Unger-Boyd, Dr. Jeannie Sahingren, she's going to be helping us out. And in those 2 weekends there, you're going to be taught. And it doesn't matter if you're a biomechanical chiropractor. I'm biomechanical. I'm a full spine doc. And yet, when it comes to cranial, unless you've taken cranial classes, you're going to need some help there. But the problem is do you really need to go to a couple 100-hour seminar, or would it be better just to learn something to take home in your practice over 2 weekends? That's how practical this seminar series is going to be, is that I'm reaching out to many of you doctors who are just very busy in practice, or you have an associate that needs more hands-on skills and you don't have time to train them. Or maybe I want to call you an old-timer, but maybe some of you just need to get out there and refresh yourself, get back to the spring, get some fresh water into your pond, help more babies. I'm a 2nd-generation chiropractor, and the one thing my dad always said about going to seminars is that you could always go to a seminar, and if I learned one little thing and I could help one patient, then that was all worth traveling and attending that seminar. And I'm telling you, these 7 live workshop classes is gonna change your practice life. It's gonna change, number one, who you are. Because you're gonna go home thinking, I never learned that, or I'm glad I had a refresher. I'm glad I was able to help that special population group, because beforehand, I would never have known how to examine them or give them a good adjustment. And beyond that, another class you're gonna get is Dr. Monica Berger. She's Queen Bee when it comes to sensory. neurodevelopment. She's written 3 chapters in my textbook, Pediatric Chiropractic, and she's going to help show you how the dynamics of body motion, movement, will help brain development. That's 12 hours of her just pouring herself into you. So on Monday morning, you're going to go looking at your kids and gait and movement all differently. And then we got we have with us in our care is the use of Dr. Dan Prince. With Dr. Dan Prince, you're going to learn about extremities. Upper extremities, lower extremities, how to work with pregnant women, and how to work with children. Like a lot of those falls or tumbles, like the first year of life, babies fall off of like chairs and swings and things like that, or toddlers falls and tumbles. And just a little misalignment of extremity can lead into adult problems later on. And so you're going to get 12 hours of exam and extremity care. And then on top of that, what we're going to be receiving, oh my goodness, the amazing Bogles, Dr. Stephanie O'Neill Bogle, Ramneet Bogle, and what they're going to be doing, the 2 of them are going to team up on you, only 45 of you, and we're going to team up showing you how to do a newborn evaluation. How to take him through physical, maybe orthopedic, neurological, infant reflexes. You're going to learn just that as a chiropractor, how to apply an evaluation. We don't need you to be a pediatrician, but just give a good evaluation in your office and give comfort and ease to those young moms and those young dads. And then doctors are going to teach you upper cervical care, how to do upper cervical with technique, upper cervical with evaluation, because a lot of times we're not going to x-ray a little kiddo under the age of 5. And so you're going to learn evaluation and different ways with different techniques. They're showing you multiple techniques, how to deliver the best Atlas adjustment out there. And of course, I'm there to give you 12 hours of amazing, number 1, pelvic floor. We're going to talk about evaluation for the women, the pregnant moms, and how to help them out. We're going to teach you the original Webster technique and the advanced Webster technique. And the thing is if it hasn't been taught by me, and if it hasn't been taught to you by Dr. Larry Webster and so forth, then you're probably not learning the original Webster technique anymore. And so as a result of that, I'm so committed through Life University to make sure that you're receiving a 100-hour certification program. And under that umbrella, you're going to also receive that certification to the original Webster technique, the advanced Webster technique, to make a difference in the lives of families. You know what? You deserve to continue your education. You deserve to walk away with confidence. You deserve to make a difference in your community, and the fact that you could change the lives of pregnant women, to the families you're going to be seeing. And the most powerful thing is, with our techniques and our confidence up there, the fact that your very first adjustment to that neonate, that little newborn in your hands and so forth, will have made a difference because you took a 100-hour program, 7 live classes. You made a difference in your life, but in the lives of others. And I'm just so encouraged, so excited to be working with Life University, so excited to take my book and make it completely live. So join us, Life University. We're looking forward to seeing you soon. Take care.